Welcome to Learning from Success, Improving Outcomes with New PrEP Options. This continuing medical education series highlights HIV prevention at the Owen Clinic in San Diego, California. The Owen Clinic is the largest, most comprehensive primary care center in San Diego for individuals living with and at risk for HIV. They provide inclusive, whole-person care from professionals who respect the beliefs, preferences, and values of their patients.
Hi, I'm Jill Blumenthal. Welcome to Learning from Success, Improving Outcomes with New PrEP Options. Single tablet, once daily regimens are common practice in both treating and preventing HIV. So in this episode, we're going to talk about oral PrEP at the Owen Clinic in San Diego. Joining me today are my very good friends and colleagues, Alan File, Monse Anguiano, and Christian Turner. Welcome, everybody. So here we are in the clinic where we do a lot of oral PrEP. That was sort of the bread and butter. It's what we started with when we began doing PrEP because it was the only thing that was available. Christian, you want to talk about sort of how you've seen that evolution over time?
Yeah, I mean, when PrEP was first released, there was only one oral option. So everybody that wanted to be on PrEP would take that medication. The nice thing about it is it was approved, studied and approved for basically all populations. So there wasn't a lot of difference in terms of screening patients for who is eligible for this agent.
Right.
Maybe 6 or 7 years later, they came out with an updated oral PrEP version, but it was only studied in transgender women and cis men. So it really limited our options when it came to cis women.
What have you seen as sort of the change over time? Are usually patients who are coming, is it first starts for them? Are they on PrEP with TDF? Are they on PrEP with TAF?
I think it's pretty mixed. We see a lot of patients that are just transitioning care to us that have been on PrEP, they're very familiar with PrEP. And then we have scenarios of patients that are just learning about PrEP. So it's pretty mixed.
This transgender patient offers their perspective about discussing oral PrEP with providers at the Owen Clinic.
I guess I would just say that I really appreciate the relationship that I get to have with my providers at the Owens Clinic. Everyone's been very welcoming and wanting to hear what I have to say, and they recognize that I am informed. And even like the pharmacist who I've never met, and probably I don't know if I'll ever speak to him again, but we had a very wonderful feeling conversation about it. So I just appreciate the approach that the clinic takes in general about like non-shameful and sex positive and things like that.
I actually love talking to this patient because it was clear that they had some background and some understanding. They were asking some very specific and informed questions, and I really felt like we could have an honest conversation about what their concerns were. And one of the other things we really try to do with patients like this is address the concerns or misconceptions that they might have about the therapy going in. We want to be honest with them, tell them what to expect, what not to expect, and really address their specific concerns in helping them decide, is this the right treatment for them? The second thing we really like to focus on with this program is establishing that personal connection. Making sure that they recognize that they have somebody that has already heard what their concerns are and is going to follow up with them and make sure that they interact with them all throughout the process, making sure that if they have any other questions come up, that they feel like they can reach out and get those answers.
Are you finding that a lot of patients feel very strongly if they're on an oral PrEP regimen, if they're taking TDF-containing PrEP versus TAF-containing PrEP?
I don't think the patients do feel strongly, but I think always the limiting factor to access to healthcare is coverage, right? Cost. People always say, how much is this going to cost me? And I think one of the things that put our program aside, that differentiates us from other providers is I'm a pharmacy technician by training. I have access to, it was kind of how we carved this position, was that I had access as a medical assistant and access as a pharmacy technician, so that I can do test claims in the pharmacy and know what's covered, know how much it's going to cost. So I can give those answers right away, and I can give the providers that answer of, sometimes when they're establishing care with a provider, I can just say, okay, this is a new patient, this is what it's covered, so you don't have to guess.
It is so valuable being able to do these test claims where I'm already usually told by you, yes, this will work, or no, this is actually someone where we're not going to be able to do that.
It's nice to be able to tell the patient what you expect, right? A 30-day supply, 90-day supply, and what they're getting.
We know that giving people 90 or more can be easier, but we are limited by what insurances will allow us to do. What are some ways, Christian, that you've sort of worked around this with patients who do struggle with that? Well, it's time to pick up, and then they'll maybe be out of their prescription for a period of time.
Yeah, I mean, I've worked in both retail and clinical pharmacy, so trying to marry the demands of the two is really important. And one of the things that we always see is it can be very easy to get somebody to get that first 30 days. In our setup here, we've got a pharmacy attached to the clinic, basically. So it's really easy to check somebody out from the appointment and send them to the pharmacy. But if they're limited to that 30-day supply, the challenge is getting them the next 60 days, over that next 60 days between now and their appointment. What if they're coming from 100 miles away for that appointment? It's not feasible for them to come here every 30 days to pick up a medication. So we have communication. We work with pharmacies that will offer other programs for them, maybe a free delivery program, or an auto refill type of call to, once they know that the patient should be running out of medication, to make sure that they're ready for that refill. And this is something we also do very early on with our new patients, is we do kind of a 1-month check-in after we first see them, just to kind of gauge, were you able to pick up your medication? If we sent it out to somewhere in the world and then that place was not able to bill it, we might not know that until we see the patient again for 3 months. So really following up with that patient and making sure that they're not having any issues that maybe we can address immediately and take care of, so that they are on the PrEP path at that point.
The summer was the 10-year anniversary of the FDA approval of oral PrEP with TDF. So we've been doing it a while. Medications are hard for people, and adherence can still be a challenge for different people. And I want to talk in a second about how we try to support adherence, because that can still come up. But I still think, just someone carrying or having a pill bottle with medications is often the easiest thing. But we still see people running into the situations where they've run out, and maybe they're out of town, or maybe their PrEP app hasn't been renewed, and they are just stuck. And I think this is where it takes getting creative with your program, with your patients, about how to make sure someone continues to have medications even if they technically can't get it. And we know there's lots of different ways to do that. Christian, what are some of the ways that you've seen happen both here and when you were in retail pharmacy?
Yeah, I think a big part of it is just understanding what the issue is for that patient. It could be as simple as, we just need to get an extension on your insurance coverage, or if you're out of town and you're overdue for an appointment, maybe we authorize one refill, but we schedule your next appointment at that same time. Really try to plan to not only resolve the immediate problem, but what caused it in the first place.
Right.
One of the nice things about oral PrEP is it's pretty widely available out there in the US. So if we have somebody stuck in New York City or New Hampshire or something, we can send it to a pharmacy that they can see, and they can go and probably pick it up pretty easily.
Right.
So it's gotten easier over time
Right.
for us to address those issues. But again, it is a matter of understanding what caused the problem. And if it's something a little bit deeper seated for that patient, they don't attend their appointments, they don't take their medication on a daily basis. So maybe we haven't seen them for 5 months, but they just ran out of their 30-day supply. understanding where the problem is coming from and making sure we try to address it in the long term as well as the short term.
Do you ever find that there's any concerns of, having a bottle that maybe has the name on it that can be difficult for patients who, this is very private for them. They don't want maybe a roommate, maybe a parent.
Yeah.
How do you advise patients who are going to be on oral PrEP how to best deal with that?
I mean, it is very patient specific. What is their concern and what is their environment like? One of the things may be just being able to store the medication in a different place or in a different container. We as an institution offer different packaging options, and patients can do those themselves as well. Different pill packs, pill boxes.
So what do you talk to patients about in terms of how they're taking their medications, and how do you instruct them or give them guidance?
Well, I think that's always the number one issue with oral PrEP, right? Is remember to take in adherence. And again, when you're looking at the population we're working with, a lot of our patients, they don't take other meds. So when you have people that have other health issues, they're taking already medication, they just add more and more pill to their box or to their they already have their routine. So usually what I tell patients is get in a routine that works for you, right? If it's you're going to brush your teeth, have your bottle there. You're going to
Take your
coffee in the morning, do that. It was always like that for me. The days that I always missed was the weekends because I was not on my routine of waking up, getting my coffee, coming to work. It was Saturday, Sunday, I always forgot. So it's kind of sharing that with the patients, right?
Yeah.
See what works for you and try to incorporate that in whatever routine that you have that you do every day.
You just brought up something that made me think about different dosing strategies, because you, as a cis man, can miss a few doses of PrEP in a week. We know that there have been studies that show that really 4 doses or more a week are protective for cis men who have cis gay and bisexual men who have sex with men. But we know that's not the case for everyone. If you're a cisgender woman, that could be a bigger deal, and we just don't have enough data yet to still tell us what that needs to look like. But definitely the messaging can be a little bit different for some of those individuals. We also know right now that there are people who really don't have sexual activity that much, but want to be protected in those times where they have it. Maybe they, once a month, they have their night out, or they travel, and when they travel, that's maybe when the activity picks up. And now we have some informal guidance that we can use or we can recommend on-demand PrEP. How are you counseling patients about on-demand PrEP?
Yeah, I mean, first, it's not something that I come right out and offer to a patient because there is not as much data there as what we have for the daily PrEP use.
It just is a reminder to me that we often need more data in some of these places, because right now, most of that on-demand data came from older cis white men, which may not reflect a lot of other populations. And there's no data for TAF-containing PrEP regimens, which a lot of our patients are taking.
Yeah, and it really is getting an understanding of who that patient is and what their particular need is, and if they're having difficulty or challenges with this daily, meeting the daily dose requirement.
Yeah.
Then this is something where maybe we can offer alternative strategies and really explain what we know and what we don't know, but perhaps it's more of a benefit to them than the substandard daily dosing that they might be doing. So, I mean, the dosing guideline is basically, they call it on demand or 211, with the idea being on the day of sexual activity, 2 to 24 hours before it's going to happen. So again, these are people that can plan or expect something to happen. They take 2 tablets of the TDF-containing regimen. And then for each day after that, their sexual activity, they're taking 1 tablet. And they're taking 1 tablet per day for 2 days after activity has stopped.
Right.
Some people can really handle that kind of discussion, and that's where it's very important to understand their level of personal medical literacy, awareness of what it is we're actually talking about, And that's where the feedback of why do they think this might be a better, or why do we think this might be a better option for them. The last thing I would say about that is having the personal relationship with the patient. They always know they can come back to us and ask us a clarifying question.
Right.
Knowing that this isn't just a one-way street of information. It's if you're ever confused or if something is different than what we talked about, please reach out, because we would rather figure this out with you than have you try to do it by yourself.
Right. And on-demand PrEP is coming up a lot more with patients. They're definitely asking about it more. And I do think health literacy is important, making sure people understand exactly what that looks like. But the two groups that I still get a little bit nervous about on-demand PrEP are young adults who maybe just don't sort of have that foresight. And I think young adults are great, but sometimes those frontal lobes aren't completely developed. And then we know with transgender individuals, it's not been studied, and we don't have the data that it would work. And the patient that was interviewed for this episode, they're a non-binary, assigned female at birth individual, but having anal sex as their main mode of sexual activity. So we knew that actually they were eligible to switch to a TAF-containing regimen because that was their main mode of sexual activity.
Each person has different perspectives when starting oral PrEP, as did this transgender person.
As someone with like a female body, the doctors did talk to me about having to take it daily and really waiting to make sure that it builds up in my system. So being able to like start the drug but have to wait a little bit gave me some anxiety and like made me really like conscious about like meeting up with people or not. But in general, I didn't have any body side effects from taking the medication. And once that first week passed, I really had a lot more like just like general security about like my choices and meeting up with people.
So we do always want to make sure that when patients ask us, when am I safe to have sex, and that usually means safe to not use a condom for concern of HIV acquisition. The field has moved more in the direction of being a little less conservative, and I think a lot of us view this as just making sure that it's built up in the plasma so that the T cells are protected. And really, my message is a little bit more universal. Tell patients it usually takes about 7 days, and there hasn't been any issue with that. We don't want people to feel anxious about it. And I think, as we get more and more data, it does help us answer some of these unknowns that we used to hedge a little bit more for, particularly with individuals assigned female at birth. I think this will be the last thought I have is, when you're establishing a PrEP program, I think a lot of places that can be really challenging because a lot of places maybe started as a clinic that serves patients with HIV, and we know that there's certain funding streams that only, are committed to patients living with HIV. So how do you do that? How do you make sure that you can pay for people's positions? And I think what we've been able to do successfully, and I think a lot of other people have, is using revenue related to prescription fills to actually support more pharmacy staff, and that's what we ended up doing. It doesn't take away all the needs, but I do think in places where there is prescription return from what an institution is doing, it's definitely to me it's one of the best ways to recommit your money is to having pharmacy staff that are really available for patients so that they can deal with a lot of these issues.
Well, and we also know that having a pharmacist on hand and having a pharmacy downstairs, we trust that they know these medications and they can speak intelligently to this and advise our patients. For a smaller program, a more rural program, or for patients that are outside of this area, it can be important to establish a trusted relationship with a knowledgeable pharmacist or pharmacy in various different areas so that that they're going to take as good of care of your patient as you would if you were doing this in-house. And they're going to look for things like missed fills or not coming back in for a fill on time, or an insurance issue. Somebody that you have that trusted relationship with that is going to take care of your patient.
I think it is. I think one of the points you're making is that if you aren't lucky to have this, I think if you're going to do this and do this well, you need to make sure that you're speaking with pharmacists in your area that you trust and that patients can go to and feel okay about getting their oral medications. All right. Well, I think that wraps up oral PrEP. It's exciting that we have these other options, and I think we'll be talking about some of those options on our next episode.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with this episode. Your certificate will be available to print upon successful completion of the brief post-test and evaluation.